Good afternoon, everyone. I'm Carrie Watson with the CMS National Training Program. Welcome to today's webinar on the new Medicare Plan Finder. I'm joined by my CMS colleagues who will be helping me with technical assistance today. We're very pleased to welcome John Booth from the Office of Communications and Ken Gardner from the CMS National Training Program. John will be giving a brief introduction, and then Ken will give us a look at how the new Plan Finder works. We'll have time to take questions after the presentation, but please wait to submit your questions to the Q&A box until after the presentation, as many of your questions will be answered during the session. I'd like to go over a few technical issues with you. There are two parts to today's training, a conference call portion and a webinar portion. If you've just dialed in, please be sure to join the web portion so that you can view the presentation. You may also wish to make today's presentation take up your full computer screen. To do this, you would click on View at the menu on the top of your screen and click on Full Screen. All phone lines have been muted so that everyone can have a good learning experience. Closed captioning is available on your screen for those who require a text version of the training event today. And lastly, a recording of today's webinar will be available on the CMS National Training Program website within 1 week. Also on that website are many helpful Plan Finder resources that are available for download. The CMS National Training Program provides basic information. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. Also, this call is intended as an informational call for partners. It isn't intended for press purposes and is not on the record. If you are a member of the press, please email our press office at press@cms.hhs.gov. And now I'm turning it over to John Booth.
Thanks, Carrie, and thanks to everyone for being on the webinar today. The new Medicare Plan Finder has now been available to the public since late August, and just last week we added 2020 plan information. I know many of you have been working with it and becoming more familiar with the new flows and features. I wanted to thank all of you for continuing to send us your feedback. It's very helpful as we continue to make updates. I know that many of you have attended one of the previous webinars, but in case this is your first time with us, I want to give some brief background and tell you about our plan for today. The Medicare Plan Finder has been around for a while, and year-round it's consistently one of the most widely visited sections on the Medicare.gov website. However, it has not changed much over the past 10 years, and it really needed an overhaul. And in fact, many organizations, ranging from beneficiary advocates to the GAO, spent time writing reports for us about the problems with the old Plan Finder and identifying those areas that needed improvement. There were also other important technical and contractual drivers behind the scenes as well, which made it essential for us to develop and launch the new Plan Finder this year before the start of Open Enrollment. It's important to say that the development of this new Plan Finder is an iterative process. That's why we've continued to add and refine features over these past weeks. And in fact, since the public launch in August and the last webinar in early September, we've made a number of improvements to the functionality and added features, some of those in direct response to concerns that many of you raised in your feedback. For today, Ken Gardner will be walking you through a demo of the Plan Finder that is live now on Medicare.gov. He'll point out some of the things that are new and some others that have been in place but you might have missed. And then we'll have time to answer some of your questions that you can send in using the chat function after the demo is finished. Before I turn things over to Ken, though, I want to address one feature in particular. We've heard concerns from many of you that there's no simple way to sort plans based on total annual out-of-pocket costs, a number that includes both drug costs and plan premiums. This is a feature that we've always planned to include in Plan Finder, and we've said it is on track to be available by the start of Open Enrollment on October 15th. In fact, we expect that you'll see it by the end of this week. Now I'll turn things over to Ken.
Thank you, John. So everybody, we're going to do a live demo today. Let me just shrink this down. So this is the Medicare.gov webpage that you're all familiar with, and of course this was updated quite recently. And Today, you would use this link here, Preview 2020 Health and Drug Plans, to access the new Plan Finder. Come October 15th, this button will change a little bit. It'll say something like Find Health and Drug Plans. So we're just going to click on that, and this is the landing page for the new Medicare Plan Finder. And we emphasize that it's best if you create an account, a username and password, and use that. You'll get the best experience. But first, I'm going to show you how you can use portions of this without logging in, and then we'll log in so we get the most robust experience. On the landing page, you've got the login button, continue without logging in. You also have a box here to learn more about your Medicare options. Perhaps you're new to Medicare or just want to get some background information. Or if say you're moving next month and you might qualify for a special election period or a special enrollment period for 2019 coverage, you can log in here to establish that special enrollment period. So we're going to click the button here, Continue Without Logging In. And first, it asks you a few quick questions. What kind of coverage are you looking for? Or maybe you don't know. You want to learn more about your Medicare options. And I'm going to start with that. Just click that button, and I'm going to enter a zip code. I happen to be in Seattle, and that's King County, Washington. So one tip is it's not as intuitive as it might be. This King, Washington comes up. You just click on that. The reason it's done this way, some zip codes span more than one county, and the plan options may vary between different counties. So we want to make sure we're looking at the right county. So we click Next, and this is where you learn basic information about Medicare. If you had clicked that you were new to Medicare on the landing page, you would have ended up in just the same place. So here you can get basic information on original Medicare or Medicare Advantage plans, and we look at it as sort of the fork in the road. You can have original Medicare or a Medicare Advantage plan, but you can never have both at the same time. So you can click on either of these. It doesn't matter which place you start. You can always get to the other side. We're going to start with original Medicare. Here we start a series of screens that educate you about basic Medicare. See, we just have original Medicare clicked at the top. And in the green box here, it says original Medicare, the Part A premium is usually free. So we're giving general information. If we tried to give all the details, we could be talking for hours, and that's more information than people want. So if people have worked and paid employment taxes for some period of time, as most people have, Part A is free. The standard Medicare Part B premium is $135.50 for most people this year. And with that, Medicare covers 80% of most medical bills. And you pay the remaining 20% out of costs, of costs out of pocket. And you can buy a Medicare supplement insurance policy, also called a Medigap policy, to pay some or most of those out-of-pocket costs. And if you want drug coverage, you can enroll in a Medicare Part D plan. And a key thing with original Medicare is that you can use any doctor or hospital that takes Medicare anywhere in the United States. And there are links here that talk about savings programs for people with lower income, where you can get more information, deeper information about original Medicare. And down at the bottom is an information box, or a warning box really, that if you try to enroll late in a Medigap policy or a drug plan, it may cost you more or it may not be available. So we're just trying to summarize key points that people need to know. On the left-hand side, we have a summary of what's included in original Medicare. So hospital coverage, which we call Medicare Part A, medical coverage or Medicare Part B. Drugs are not covered at this point. Help with out-of-pocket costs aren't covered. There's a green, and I should say there's a green checks and red X's for what is and isn't covered. We've got a green check for use of any doctor or hospital that takes Medicare across the United States, and a red X by vision, hearing, and dental, because by law, original Medicare doesn't cover any of those items. And down at the bottom, a summary of the premium costs. So the total monthly premium for original Medicare for most people is $135.50. So let's say now we want to explore what would happen if we add a Medicare supplement insurance policy, a Medigap policy. So if we do that, the green box on the right now talks about Medigap policies. And it says the premium policy range in my zip code goes from $44 to $212.57. And that's because there are many different Medigap policies and many companies offering those all at a different price. What those policies do is they pay most of those 20% of costs that original Medicare doesn't cover, plus some other costs depending on what plan you choose. And the plan can never drop you or change your coverage, and the premium ranges reflect the different prices companies can charge. And then again, there's this warning. If you don't enroll in a Medigap policy when you're first eligible, you may not be eligible to buy one later or may pay more. They're talking about that 6-month guaranteed issue period when you first have Medicare Part B and are 65. So on the left-hand side, you see it looks much the same as before, except that now we've added a green check next to help with out-of-pocket costs, because that's what the Medigap policy does. And down here, the Medigap premium policy range has been added in addition to the Part B premium, because we don't want people to forget that, and a total of the two together. Lastly, adding a drug plan, we click that button, and now we've got drug plan information. Let me just point out, we're going to talk about this, but original Medicare and Medigap policy information is still there. If we want, we can just click on the arrow to open that up and review it, or we can shrink it back down and we'll look at the drug plan information. So drug plans in my zip code vary from $13.20 to $120 per month. And they add separate coverage to original Medicare, and you can generally switch these once a year during open enrollment. Each plan varies in costs in which drugs are covered, and of course, the premium ranges reflect the different plan pricing. And once again, there's a link to tell you about programs that can reduce your drug costs, and also general information about drug plans if you want to learn more. And that caveat, that warning down at the bottom, that if you don't enroll in a drug plan when you're first eligible and you enroll later, you may have to pay a penalty for as long as you have Part D coverage. On the left-hand side, you'll see we've now got a green check next to drugs. So now with these options, original Medicare, a drug plan, and a Medigap policy, we've got pretty complete coverage. Everything that Medicare covers along with the supplements. And we've got the 3 premiums here, the Part B premium, the drug plan premium, and Medigap, all shown in ranges depending on what you pick. And the total premium, if you add that all together, could be as low as $192.70 or as high as $468.07. So that's the basic summary, the information most people want to know to get familiar with original Medicare. Let's talk now about Medicare Advantage plans. Notice that if we click Medicare Advantage plan, the checks next to all the original Medicare items go away because you can't have Medicare Advantage at the same time as original Medicare. The green box now shows the Medicare Advantage plan premiums in my local zip code, which go from $0 to $295, and it talks about how Medicare Advantage works. All hospital or Part A benefits and medical Part B benefits are provided by Medicare-approved private companies. And the second point is important. You must use doctors and hospitals that are in the plan's network for non-emergency or non-urgent care. If you have an emergency, you're covered around the United States by going to another Medicare provider. Most plans do include drug coverage, but not all, and they're listed together. Many plans include extra benefits like vision, hearing, and dental. And unique to Medicare Advantage plans, there's a yearly limit on your out-of-pocket costs. That's not true with original Medicare, which is why many people consider a Medigap policy to limit that. And information at the bottom, if you don't add a Medicare Advantage plan when you're first eligible, you may have to wait for next year's open enrollment period before you can enroll. So on the left, it talks about what's included in a Medicare Advantage plan. It includes hospital, medical, usually drugs, help with out-of-pocket costs, and vision, hearing, and dental, but not use of any doctor or hospital around that takes Medicare around the country. So it reminds people you have to stay within the plan's network. Down at the bottom, we remind people they still have to pay their Part B premium and the Medicare Advantage plan premium range, and add those together at the bottom. You could pay as little as $135.50 or as much as $430.50 in the Seattle area. So that's the basic information meant to educate people new to Medicare, or just if they want to review what their options are. At this point, you can click Ready to Continue, and it takes you further into the Plan Finder. It assumes, since we were looking at Medicare Advantage plans last, it's got that clicked or checked and tells you what that is. But if instead we're just looking for a drug plan, we can click that, we can do whatever. It does remember that we're in King County, Washington, and it asks us, because we haven't logged in, the system doesn't know any of our demographic information, so it asks us if we have Medicaid or Social Security, supplemental security income, etc. So at this point, I'm going to remind you that for the best experience, you want to log in or create an account. So I'm going to go to the login page. You also could have clicked that button down below. And we're going to sign in with the username and password because I already have one. But if you don't, you can create an account down at the bottom. You just press this Create an Account button. It's very simple. It's 2 screens. Just takes a couple of minutes. And you'll have instant access. We do have a separate video available. It's in the resources page, so I'm not going to go through that today. So I'm just going to log in. And we've created a fictional identity here for this demonstration. So we're going to pretend that my name is Stephen Smith. And I am currently covered. Since we've logged in, it knows my current coverage. I'm covered by Blue Advantage Complete, which happens to be in Alabama. And I do not have any extra help or other subsidies at this point. And let me point out that up here in this box, if you click on that, it has the same information, and that's at the top of every page. So it shows my current enrollment and my current subsidy. Down here, it asks what sort of coverage am I looking for, and for the time being, we're going to say we want a drug plan, and later I'll show you more about Medicare Advantage plans. And it wants to know what zip code. Now, I'm logged in. You may ask, doesn't it know what zip code I'm in? Well, it does know where my current coverage is, but in this case, Stephen Smith lives in Alabama, but now he's going to search for a plan in Washington. Maybe he's moving here. And there's a box here that we've added based on feedback that we've gotten since August. Is the help that you get with your costs now different from what's listed above? We know a lot of people are, they've gotten a letter saying they're going to have Medicaid as of January 1st, or they're getting SSI, or something like that. And you can check any of those boxes to add that level of coverage, and it will price those plans accordingly. But in this case, I'm going to say I don't get any help from those programs, and I'm going to click Next. So next it wants to know, do I want to see my drug costs when I compare plans? Well, sure I do. And how do I normally fill my prescriptions? Retail pharmacy, mail order pharmacy, or do I use both? I'm going to click Retail Pharmacy today, and we'll go next from there. And here's one of those key things that you get when you've logged in. The system will bring up the first time you use use the Plan Finder, it'll bring up a list of all the prescriptions that you've filled using your Medicare benefits in the last 12 months. If you're new to Medicare, if you're just joining, there won't be anything on the list because you might have been using some other coverage to do those. But if you have been using Medicare at any time in the last year to fill your medications, you get this list. And you can pick the ones that you still take. Maybe you don't take the others anymore. Or if you want all drugs, you can just click all drugs. I'm going to clear that. I'm just going to take omeprazole and prednisone for the time being and show you how to enter more drugs. We click Next. And this shows us our drug list. So right now we've accepted these 2 drugs based on the claims. And if the dosage and quantity is the same, that's fine. If perhaps it's changed, we can click Edit Drug, and we can change to a different dosage. Maybe we want 20 milligrams. I'm just going to leave it at, I'm going to leave that at 40. And add that to my drug list. So let's say that these 2 are fine, but I'm not done adding drugs yet. I could, if I'm finished, I just click here. But I can add more drugs, and I want to do that. So let's say that Stephen has diabetes. So he takes insulin every day. So he takes one called Humulin. So we're going to type that in. And it brings up a list of the drugs. Now here's Humulin. And you'll notice that I mistyped it up here. I used an A instead of a U. And if I'm sort of close, the system will find it and it will give me suggested drugs. We click on the one that we want, then add drug, and then I get to tell the system what dosage. So insulin comes either in a vial or in a pen injector, and I like the injector. And anything that's injectable has a packaging field. Pills don't ask you this question. So in this case, you can get 1 3-milliliter pen or a pack of 5 pens, and I'm going to say, well, let's take a pack of 5, and I use about 1 every month, and add that to my drug list. But I'm not done. Let's add a little more. So Stephen also has arthritis, and he takes Celebrex. And despite the fact that I have the cap lock on, it defeats that. So we pick Celebrex and click Add Drug, and we get a pop-up because there's a generic that's a much lower cost for Celebrex. And you'll get this whenever you add a brand name if there's a generic option available. And you can click this button to add the generic automatically, or you can add brand instead. For today's webinar, what we're going to do is we're going to add both. So I'm going to add the generic, and in most cases it will come up with the most common dose as a suggested dose, but then you can change it to whatever you want. We'll just leave it at that most common dose. 1 per day would be 30 per month. Add that to my drug list. And a common question that we've gotten is, can we add the same drug more than once? And the answer is yes, because some people take a different dosage of a drug at different times of the day. They might take 100 milligrams in the morning and 50 milligrams in the evening. So we're going to add it again, but what we're going to do is we're going to put in Celebrex again. And this time, instead of adding the generic, we're going to add the brand. And I'm doing that because I think it'll be interesting when we get to pricing, and I just want to show that to you. So we'll put in the same dose, 200 milligrams, 1 per day, add that to my list, and we'll say that's my complete list. I'm done adding drugs. I can either click on Done here, or every time you add a drug, it tells you what's been added, and now we have 5. You can also just click Done here. Now we need to pick pharmacies, and we can add the mail order pharmacies to the list as well, but I'm not going to do that this time. We're going to pick some local pharmacies that Stephen might want to go to. So Bartell's is a local chain in Seattle that's pretty popular and takes a lot of or contracts with many plans. So I'm going to suggest he looks at that, and CVS, and the other one that's within walking distance is Walgreens. It's on the second page. So now we have 3 pharmacies we can price. And you may note that that's something new. Heretofore, the old Plan Finder has only been able to price 2 pharmacies at a time. We released just last week in the new Plan Finder, we can price 3 pharmacies at once, and that helps you find the best solution for your particular situation. So if you've got a pharmacy on your list and you want to change it, you just exit out and pick a new one. But once we've filled up all 3, all the other options gray out. So we're going to say we're done and take a look at what prescription drugs plans are available. Now, whether you're looking at drug plans or Medicare Advantage plans, you always see what we call the plan card here at the top for your current plan. So Stephen is currently enrolled in Blue Advantage Complete. This shows the 2019 pricing. Soon we're going to update this to show the 2020 pricing at the top. If we searched plans down below, if we were looking at Medicare Advantage plans, we could find the 2020 version of this. But since we're looking at drug plans, we've got the list below of just drug plans. Now you can sort today based on yearly drug deductible, drug cost, or plan premium. And as John said, by the end of this week, we'll have another option there to sort by the lowest total out-of-pocket costs, including premiums, deductibles, and the cost of the drugs. But today we're just going to look at the lowest drug cost. And you can see his costs are really high. The lowest drug cost available to him, this is the cost for the entire year of 2020, is $6,165.73. And we're going to take a look at that and try and figure out if maybe we can get him a little better deal. So we can compare up to 3 plans at a time. So I'm just going to click this one because it's the lowest cost. And there's one from Assurus. We'll click that is next. Another one from Assurus. Well, I want to get a third company, so we'll look at Express Scripts. And we'll just compare these 3. You can compare 3 plans at a time, side by side. You get sort of summarized information, and then if you click on the Plan Details button, which we'll do in a minute, you get much more detailed information about just one plan at a time. So you can see the premiums for all 3 plans, $46.30, $120, $53.80, and the yearly drug deductible. So this one's fairly low at $100. This one has $0 deductible, and this one has $435. And so often you see higher priced plans have lower deductibles. This one's sort of a compromise. If we look here, we can see what drugs are covered and not. 4 or 5 drugs are covered in each case. And that's probably why his costs are so high, and we're going to look at that in greater detail. And then here's the summary of the yearly drug costs at each pharmacy. You can see for this first plan going down, Bartell Drugs is a preferred in-network pharmacy. So is Walgreens. CVS is a standard pharmacy, and here are the yearly amounts it would cost to fill his drugs. And then the mail-order pharmacy is slightly less in this case. If we go to the second plan, all 4 are standard in-network pharmacies. And the third plan, Bartell's is out of network, so you don't get any benefit, any discounts there. It would be $17,000 and change to fill his drugs. Walgreens is preferred, etc. So this is just the summarized information that we see here. We're going to look at the plan details page to get a lot more information. This Cigna plan looked like maybe it was the best. It was a relatively low premium, low drug deductible, and lowest cost drugs. So let's look at the details and see what's available to us. So here we can see again the premium and the drug deductible, and here we get complete information on what makes up the drug costs. And you begin to see why Stevens drugs are so expensive. The Celebrex, the brand name drug that we put in there, is $456 a month. And you see it's the same whether he's paid his deductible or not. So that's a good indicator that this isn't covered, and we'll confirm that down a little bit lower on the screen. The Celecoxib, which is the generic for Celebrex, is $11.74. So certainly a bargain in relative terms, and you can see that changes when you get to the coverage gap, etc. You're just seeing how the pricing works. Humulin, that's a real bargain. It goes from a $500 retail price down to $2 a month for that, before and after you satisfy the deductible. And then in the coverage gap, it goes up if you've been following the coverage gap. In the coverage gap, you pay 25% of the cost of your drugs. So 25% of 500 is 125. And if you pay a certain amount out of pocket, and very few people do, if you're in about the 95th percentile, you get to what's called the catastrophic phase, where you pay about 5%, and there his cost would drop to $25 a month. His omeprazole and prednisone are both quite inexpensive, and his total per month is $473.36 while he's in, both before and after he's paid his deductible, and then when he goes to the gap, it gets a little more expensive. So down below is a monthly chart showing what his costs are. You can see it's August before he starts phasing into the gap, and then he stays at the gap coverage level. He never quite gets beyond that. If we look at Walgreens, it's got a similar chart, and the retail pricing is a little different because every pharmacy is a little different. Different stores, different price. You'll notice the Celebrex is about the same. The Celecoxib is $42 versus $11.74 above, so that's pretty different. Humulin's the same. Omeprazole and prednisone are very similar. And overall, you'd pay $503.75 per month, so it's quite similar. Same chart, and also for CVS, similar cost structure. If you go further down, there's other drug information, and it shows the tier level for each of these drugs. Okay, I'm taking too long, so it asked if I was still there. So here's the tier level for each drug, and you'll see it says for Celebrex, the brand name drug, it is not covered. So that confirms my suspicion. That's why the price is so high, and we're going to do something about that. We also have some drugs under certain plans will have a prior authorization where you have to contact the plan for certain information. In this case, prednisone does. And also there are quantity limits, in this case for omeprazole and Celecoxib. And quantity limits, there are a number of reasons for those, but usually it's some sort of a safety factor. The pharmacy community says if you take too much omeprazole, you have certain problems, certain side effects, and so they don't want you to go beyond a certain amount. So we've just got a yes and to contact your plan for more information. At some point in the future, we'll be specifying the exact quantity limits on this list as well. If you go down further, it recaps the drug list that you set up before. So this is everything we put in, and it shows whether it's brand or generic. And a lot of people have missed it. I've gotten a lot of questions. From this page, we can go back to edit that list. So we're just going to click on this link, and we're back to where we started with the drug list. Now remember that Celebrex wasn't covered by any of the three plans, and it was really expensive. It was $450 a month or so. So let's say Stephen has decided, after looking at this, he doesn't want the brand name, he wants the generic instead. So we're just going to take the brand name off because we priced both the brand and the generic at the same time, and we're going to see a very different result. So now we've only got 4 drugs on the list. We're going to say we're done. We get to revisit our pharmacy selections. We're not going to change them though. And we will sort again by lowest drug cost. And and you'll see this cost was about $6,700 before. It's dropped down to about $700. So it's very, very different, and we'll look at the details. I also want to point out something that's sort of a bug in the system right now. It just came up last week. It's saying 0 of 3 pharmacies are in network. That is not correct. We hope to have that fixed before October 15th. But we're just going to go straight to the plan details for Cigna. Well, we'll go to the compare page just so we see all 3. As it happens, the same 3 drug plans were the least expensive on that sort. That's not always the case when you change your drug list. Now you see 4 prescriptions are covered, and on this page is correctly showing which pharmacies are in network. In this case, everything's in network except Bartell for that 3rd policy. So if we look at the plan details at Cigna like we did before, you can see now that without the brand name Celebrex, his monthly cost has dropped to $17.22 a month, which is a very good result. And he will stay there until he phases into the coverage gap and it goes up a little bit. 2 things to note here. Nothing says you have to fill all your prescriptions at the same pharmacy. If Walgreens is closer and he'd rather go there to fill his first 3 of his prescriptions, he can do that, but he can walk a little further to Bartell and get his celecoxib a little cheaper. Most pharmacists will recommend you get all your drugs at the same place because they like to make sure they don't have drug interactions, but it's totally up to you. So basically you can see everything's pretty well covered now. His costs are much lower. And at the very bottom, we have information for the star rating. We can open that up. Now, the star ratings for 2020 plans will be released before October 15th. That's the same as every year. There's also a link here for detailed information on how we determine these star ratings. There are many, many factors involved. And at the very bottom, there's a link to view the plan website and the phone numbers if you're a current member or a non-member, in this case, for that Cigna plan. If we go back up to the top, actually, we're going to go back to the plan comparison page. And if we wanted to enroll in that, well, of course we can't enroll because it's before October 15th. It's just plan preview right now. All you can do is look at it. And by the way, every time I give a presentation like this, somebody always asks, are we trying to talk up one insurance company or another, or Medicare Advantage over Original Medicare? It's not the case. In this case, I'm just picking pharmacies that are within walking distance that are major chains, because that often works well for the pricing. I'm picking the least expensive plans. I don't have any agenda here. So if you were going to enroll, you see an enroll button like this. Now this is for the 2019 plan, so that's open for enrollment. 2020 plans aren't yet. So I'm just going to go back up to the top and point out that we were just looking at drug plans. You can also hit this link here to view the 41 available Medicare Advantage plans. So we'll do that real quickly, and now you'll notice the link would let you go back to drug plans if you want. Always has his current information here, his current plan, and now we have 41 Medicare Advantage plans in the area, and we can sort them in pretty much the same way, by premium, drug deductible, health plan deductible, drug cost, or lowest monthly premium. We're going to sort them by drug cost. And I want to point out a couple other things. We didn't do this on the drug plans, but you can. There's a filter plans button, so maybe we don't want to look at compare 41 plans. If you click filter plans, there are a number of ways that we can filter plans to see what we want. So we have star ratings. Maybe you want a pretty high star plan, a 4 stars and up, which means the plan has been pretty well received. You can also pick a particular insurance company if you want to. We're not going to do that. Maybe it's a deal killer for you if there's no vision coverage, so you want to click that. Or you may need a hearing aid, so you want to make sure it has hearing coverage. Whatever that may be, you click on it and you can see this list. We had 41 plans before. Now we're down to 23. That's still quite a few. Let's also add a transportation benefit. Now there are only 7 plans. So whatever filters you choose are the best for you. You click those and it will lower the numbers for you. And we're still sorted here by the lowest drug cost, which we did before. I also want to show we have something for adding special needs plans. So if you have Medicare and Medicaid, you're dual eligible, you can click this and it will add dual eligible special needs plans, or SNPs, to your list. Or if maybe you have a chronic or disabling condition like a stroke, cancer, or dementia, you can click that. Or if you're in a long-term care facility, you can click this and you'll see the plans for people that live in long-term care facilities. But we're not going to do any of those, so we'll just leave it at the 7 plans we've got. And we'll just click the top 3 for compare. Well, actually, the top 2 are Humana. Let's do a Humana and a Kaiser. It looks like there are only 2 companies here. We'll do 2 Kaiser plans. Oh, yes, we've already got... It starts with his current coverage. We can leave that there, but if he's moving from Alabama, he won't want that, so we'll just add a second Kaiser plan. And here you've got something that looks very similar to what we saw on the drug plan side, a summary of the premiums and the deductibles, and when you get down here, it'll show the cost to see a primary care doctor or a specialist, lab tests, imaging, emergency care, urgent care, what you pay if you go to the hospital. And under extra benefits, we've added a number of features in just the last week or so. All types of hearing aids. You know, this plan has copays of $3.99 to $6.99. This one says $0 copay. That one's $0 copay. In this summary, if it says $0 copay, you need to make sure you understand the limits in terms of the plan. So we're going to go to plan details to look at more information there. It also has preventive dental, comprehensive dental, eyeglasses, and we'll look at that in more detail. When you get down to the drugs covered, here we're running into some problems. One of these plans is not covering any of those drugs, and in this case, 3 of the 4. So you need to take that into consideration. And when you look at the plan details, you can often figure out the issue. In this case, I think it's Kaiser will only cover their own pharmacies, and we don't have any of those selected. So let's just look at Humana, say, for the plan details, and you'll see there's much more information available. The same summaries as before, but there's a little more information. For example, diagnostic radiology services, the copays range from $40 to $360, or 20% of the cost. And limits apply. You have to have advanced plan approval, and you have to have a referral from a physician. If you go down, I want to show you some of the vision and dental benefits and such. So hearing exam is $40, $0 copay for that fitting or evaluation of a hearing aid, and hearing aids range from $3.99 to $6.99, which sounds like a lot of money, but hearing aids are really expensive, and there may be limits on how much the plan will provide. Preventive dental, it tells you what you pay for an exam, cleaning. Fluoride treatments aren't covered. Those are usually for kids. Dental x-rays, again, tells you if there are limits and maybe some information about that. Comprehensive dental, it says, is not covered. And vision benefits shows what you pay for a routine exam, contact lenses, eyeglasses, frames, and lenses. They've broken that all out separately. That's a new feature. And it tells you what the limits are. You have to have a physician referral in this case, etc. And it goes down for all the many benefits that are available. And sometimes there are optional packages you can buy that includes preventive dental services and some comprehensive dental for an additional $44.50. And it tells you how your drugs are covered. So that gives you the basic information of how you can search for a Medicare Advantage plan as well. And one last thing that I didn't show you before, let me go back to the plan comparison. The website is available in English and Spanish, and if you click on Espanol, then it will translate the page to Spanish for you if you're working with a client who speaks Spanish primarily. Or we just click back to English for that. So with that, that's the basic presentation on how to use the Plan Finder. You're looking at the live Plan Finder and shows you just how quickly it works. I'm going to go to a summary here. So some of the Plan Finder updates that we've added just recently, you may not have noticed it yet. One thing, I should have shown you this, I can go back and do it. Big announcement, the old drug list from the Legacy Plan Finder, we've now added that back so you can access that from the system with or without logging in, but that's only until OEP. So maybe I can just take you back and show you that since I forgot to do that. Let's see, I'm going to have to go pretty far back. I'm not sure if it'll let me do that. Well, I'll take you back to that in just a minute, or actually I've got a screenshot. I should have shown that to you before, I apologize. But down, when you're adding drugs, at the Add Your Prescriptions Drugs page, you'll see a link here for Find Your Saved Drug List. If you click on that, you can do it, and you can do this whether you're logged in or not. You can put in that drug list ID and password date that you have from the Legacy Plan Finder and pull up your list. It will not add it to the new Plan Finder, but you can look at it, you can print it, you can get that information, and I just want you to be very aware that's only available until the end of OEP. It's a one-time only thing. So going back to the updates, we can now price 3 pharmacies at a time, and you can add the mail order option from that pharmacy selection page. We have improved information on pharmacy benefits, on vision benefits, comprehensive dental, and hearing benefits, talking about the hearing aid types, frames and lenses for vision. We've added improved labeling of the special needs plans. And when you're logged in, you can manually change your low-income subsidy status if the information that you're seeing isn't correct or your status is going to be changing before the end of the year. And in-network pharmacies now show as preferred or standard cost sharing, which wasn't the case when we first launched this in late August. Now, some of the updates we expect to go live by October 15th. As John mentioned, the total out-of-pocket cost sort should be there by the end of this week. Drug tiering costs, right now it just says what tier a drug is in, but it should have the actual cost for that particular plan. I should be showing this a little different way, be easier to see. We're going to be integrating folks that have partial coverage gap benefits into the cost sharing, so some plans cover certain drugs during the coverage gap, and we'll be handling that a little bit better. We're going to maintain the filters and the special needs plan selections when you use the back arrow when you're navigating. We've heard a lot of comments about printing, that there's too much white space on the paper. You get many more pages than you need. We are working on that and should have that done by October 15th. We also, by the way, have already made many improvements for several of the web browsers. Still having a little trouble with some Microsoft Edge. I use Chrome and it works quite well. Also, the current plan card that I was showing you before that shows 2019 pricing will reflect the 2020 pricing by the time we get to October 15th. And when you put in your zip code, we've gotten a lot of comments that that's not real intuitive, so we're going to make it look like this. When you put in your zip code, it now is going to show the zip code and the full county name. You click on that to do your selection. So that's really all I have. We're going to go forward and let you ask your questions, and John and I will do our best to answer. And I'm just going to show you some of the resources that are available, and you can get to these links through the resources page in this webinar. So I will turn it back to you, Carrie.
Thank you, Ken. And we've gotten many questions into the Q&A box, so we are going to try to get through as many as we can today. The first question is for John. John, we've had some questions about Medigap policy price ranges. Can you talk a little bit about that?
Sure. So yeah, we have heard some questions coming in around Medigap data, and we actually did a refresh of that data yesterday, so I would ask people to go out and take a look at that. The way CMS does collect that data is somewhat manual, so as we hear about data issues, we go out and investigate those and make corrections, and we're looking at ways we can make that better in the future. Great, thanks.
Hey, Ken, we've gotten quite a few questions about medications that are only filled one time a year. Is there an option to select that in Plan Finder?
At this point, there is not. That's an issue that we're aware of, and we are working on it. It may not be available by October 15th, but we hope to get that to you soon. And I'm going to digress and just talk about those Medigap policies for a moment. One thing I said erroneously at one point, and the information stuck, I'm afraid. I want to make it clear, you cannot enroll in a Medigap policy through the Plan Finder. You can get basic information, but you may have to go through an insurance agent or contact the plan that or the company that offers that Medigap plan to find out the exact pricing and enroll in that plan.
Okay. Okay, next question for you, Ken. I tried using Plan Finder looking for a PDP, entered a drug, and all PDPs were displayed, but only 2 plans had the drug on the formulary. What do you do about that?
Well, that probably wasn't a very common drug, and that is the key to getting good pricing, is finding an insurance company that will cover that. So if you're using an uncommon drug, you may need one of the higher premium, we call them enhanced plans, that have bigger formularies, and that's probably those 2 plans you found that covered that drug.
Okay. Okay, next question. If a plan covers telehealth services that are only basic Medicare coverage, Medicare Plan Finder displays that telehealth not covered. What should we do about that?
Well, that's a new issue on me. What I would ask is that you please send something to our feedback email address, which is emedicare@cms.hhs.gov. And if you can please give us a screenshot, the zip code, all the specific information that you can, so we can recreate the problem, we'll try and figure out how to resolve it.
Okay, great resource. Okay, without creating an account, can we still retrieve a prescription drug list with the retrieval code and password date as we could before?
The answer is yes. You can retrieve it in read-only format. You'll still have to enter those drugs into the Plan Finder to create the new drug list, but that in order to price the list. And when you're not logged in, that drug list is not saved. So we really recommend that you create that username and password so that the work you do will be saved so you can revisit later during OEP or next year at the beginning of OEP.
All right. Will the star ratings be added by the open enrollment start date?
Yes, they will. Star ratings historically have been available approximately September 10th. No difference this year. I don't know the exact date because it can vary a few days, but they will be in the system before October 15th.
Okay, thank you. Do we need to create an account as a broker looking for plans for clients? Is this meant to be client-specific?
Yes, accounts are client-specific because the system, as you'll recall, brings up that pre-populated drug list based on the prescriptions that person has filled, and it shows what their current enrollment is, etc., saves the drug list. So each account is specific. Each user ID must be unique, and we ask that you work with your client to help create that account in order to do so.
All right. We have had some errors when trying to create a new account. We triple check all the information is correct, but we get an error back saying that the system cannot create an account based on the information at this time. Do you have any suggestions on how to fix that?
Once again, that's something you can send to eMedicare at cms.hhs.gov. But my basic suggestion is call 1-800-MEDICARE. They can take a look and see what's wrong and try and help you establish that account.
Okay, great. Is there going to be a clarification available that members may be seeking coverage in a county that covers more than one zip code? You need to input the county name versus the zip code numbers?
You start with, yes, we are making this more intuitive, and let me go back to that slide. So if this is what we're doing down here. You always put in your zip code, and if that zip code covers more than one county, then both counties will be below, and you click on the county that you live in order to get the proper result. And that update will be in place by October 15th.
Okay. Next question, why do you always show mail order if they don't want to know it?
Well, we don't always show mail order. If you X out the mail order option, I don't believe it will appear. It might show up at the bottom, but it's just additional information.
Okay. Are we supposed to ask our clients for their username and password? Is that a HIPAA violation?
Well, data security is very important to us, and we also know that the relationship between an agent or a broker or a ship counselor and their client is important, and that historically, some sensitive information has always been shared in order to best serve the needs of that client, and it's a fiduciary relationship. We believe that agents and ship counselors alike can continue to use the new Plan Finder to serve their clients, and it's in the best interest of people with Medicare to create a username and password to maintain the security of their data.
Okay. When first creating an account, how does the system connect my new account to the drugs I've had filled in the last 12 months?
Well, if you've been in Medicare for some period of time before creating that new account, what happens is the Plan Finder accesses the Medicare claims database for prescription drug claims and creates that list based on medications that you've filled in the last 12 months. Again, if you're new to Medicare, if you don't have any Medicare paid drug claims in the past, nothing will come up on that list.
Okay. I have worked with several individuals who have logins and been on Medicare Part D plans, and their drugs were not listed. How can we access the information for these individuals?
Well, that's a good question. If you can give us a specific example, we'll try and track that down, because we should be seeing those drug claims. If they are using their Medicare coverage to fill those drugs, they can do it. Now, there are options. Some seniors will go many different pharmacies like Walgreens or Walmart or CVS, Target. They all have programs where certain low-cost generics can be purchased for maybe $4 a month, something like that, without using your insurance coverage. If they've gone and gotten their generic medications that way, then it doesn't create a Medicare claim and they won't come up on the list. But that's the only reason I can think of that should happen.
Okay. The old Plan Finder would tell us whether or not someone had Medicaid and at what level. Does the new Plan Finder have that capability?
Yes, it does. Let me see if I can pull that screen back up here. So when you first log in, it will tell you that. And mind you, you have to be logged in to do it. Also, this green box here, if you click on it, shows your current coverage and your level of subsidy. Now, we recognize one of the things we're working through right now is people that are in Medicare and then gain extra help or Medicaid, something like that. The information we're getting is coming up correctly. In some cases, people that, for example, maybe they had Medicaid and now they've aged in to Medicare, sometimes that information doesn't come through to us properly, and we're trying to fix that. But that's why when you first log in, there's that button that allows you to, it says, you know, do you anticipate having extra help or a subsidy that isn't showing here, and you can add it manually. And that's our current fix until we resolve the issue of picking up folks that may have gained coverage that we're not seeing in the system.
Okay. And it's about 3:02, so I want to be mindful of our time. We have time for about 2 more questions. The next one is, can the fake account username and password be shared so that we can use this when training our volunteer SHIP counselors?
Unfortunately, no. We only have a couple of these test IDs, and for technical reasons, we're not able to give them out. One of which is only one person can be logged in at a time, and our programming team is using these to test some of the improvements as we go along. So I'm sorry, I cannot share this.
Okay. All right, and one more question. Is there a way to go back to the drug list after we go to the comparisons?
Yes, absolutely. There are several ways, one of which just show you on the screen. If we go to plan details, this works for PDPs or Medicare Advantage plans, go down near the bottom of the page to your current drug list. You just click Edit Remove Drugs, and you're back at that list. You also can go back to the beginning by logging out and logging back in, but usually that's the easiest way from the compare list. Just go to the bottom of the plan details on any page and click that link.
Okay. All right. A lot of good questions today. Thank you so much, Ken, for taking the time to answer those questions, and thank you, John, for answering some questions and for your presentations today. As a reminder, today's webinar was recorded, and it will be available in the next week at cmsnationaltrainingprogram.cms.gov, and that's showing the link on your screen. And then, again, there's the other Plan Finder resources that are also available. To see our other upcoming training events and recorded training webinars, as well as other available Medicare training materials and resources, please visit the same website. And we thank you so much for joining us today. Have a great day.